Hello, everyone, and welcome to Know Your Body, Control Your Own Health, a podcast created to share public health information with students at Purdue University. I'm your host, Gabriella Clark, and in this episode, I'll be discussing the importance and details of screening for cervical cancer. Across the world, cervical cancer is the fourth most common cancer among women or individuals assigned female at birth. This may be a daunting fact to some, however, cervical cancer is preventable. One of the many ways to prevent cervical cancer is regular screening. Cervical cancer screening includes two tests, the HPV test and the Pap test. The HPV test is important for cancer prevention as it detects the human papillomavirus, which is the most commonly sexually transmitted infection and the leading cause of cervical cancer. HPV has the ability to turn off tumor suppressor genes and cause harmful changes to the cells of the cervix. The Pap test is also an important aspect of screening as a test for cervical precancer. Precancer is cells in the cervix that appear abnormal but are not yet malignant. When precancer cells go without proper diagnosis and treatment, precancer cells are likely to become cancerous years later. It is recommended to start cervical cancer screening at age 21 and continue screening until age 65 if prior tests have appeared normal. While I have never had a Pap test done before, I know the anxiety many people experience when it is time to visit the doctor or gynecologist. In my experience, it is important to find a doctor that is trustworthy and takes your comfort into consideration. There are many stories of women who have had their lives saved by cervical cancer screening. I invited Audrey Harrison to share her experience with cervical cancer screening today.
Thank you so much for having me. I remember the devastating feeling of being told that my Pap test showed signs of precancer. With the help of my supportive doctor and family members, I was able to treat the precancerous cells before they advanced any further. Had I not gone to my regular screening appointment, I could have developed a life-altering disease. I would have had missed out on so many memories I've made with my family since then. I want to stress the importance of getting cervical cancer screening regularly. It's saved my life.
Yet, there are still many individuals who are overdue for their screening. Studies have shown that 23% of individuals assigned female at birth were without up-to-date screening in 2019 compared to 14.4% in 2005. With the advancements in knowledge and technology we have now, it is alarming to see that the rate of overdue screening has increased. Additionally, the higher rates of overdue screening were present among certain demographics, such as those of Asian ethnicity and those identifying as part of the LGBTQ+. The most common reason given for being overdue for cervical cancer screening is lack of knowledge. Know Your Body, Control Your Own Health sent out a survey to retrieve statistics on cervical cancer. The results of the survey showed that out of 58 responses, approximately 33% of respondents were not confident at all about their knowledge about cervical cancer, and approximately 40% were only slightly confident about their knowledge in cervical cancer. Additionally, 71% of the respondents did not know the early signs of cervical cancer. The most concerning part about the results of the survey was that 84% of the respondents stated that their biological sex is female. Knowing this information, it is essential to educate women and individuals assigned female at birth on the importance of regular screening. Spreading awareness creates the potential for more lives to be saved in the future. Thank you for joining in on another episode of Know Your Own Body, Control Your Own Health. The information and statistics from this podcast were provided by the U.S. Preventative Task Force and the CDC.